Hi! Today, we will talk about the guided surgery kit of the Epikut line, using a drilling sequence as an example. The kit has two levels, the tray and the removable bottom. Lift the tray out of the kit. Remove the bottom and put the tray back on its base. The kit also includes the drill stoppers, integrated into the tray. Additionally, the Epikut line provides a specific drilling sequence for each bone density, increasing clinical versatility. We will be using the Epikut Plus implant, more stable platform with a diameter of 3.5 mm and 11.5 mm in length. For this simulation, we will use the narrow sleeve system in its H6.5 condition. We start by securing the guide using the 1.3 mm drill. Place your tool inside the lateral sleeve and start the rotation. Once the drilling with the 1.3 mm drill is done, select the pin clamp from the guide and place it by pressing it. Note that the sleeve of the Epikut line narrow system, diameter 3.5 mm, is pink. That is why the drill handles also have pink-colored marks on it for easy identification during the drilling. Remember that, since we are using the H6.5 condition, we must add 1.5 mm to the drilling, and compensation for the distance. Let's start the drilling sequence. Choose the 3.5 mm diameter tissue punch. Since we use a narrow sleeve, a drill handle is not necessary. We put the tissue punch directly into the sleeve. Now, we will start drilling with drill A, the twist drill with a diameter of 2 mm. We place it in the contra-angle handpiece. Remember that we are using the 1.5 mm implant in its H6.5 condition, adding 1.5 mm to the drilling. Therefore, we will select the 13 mm drill stopper. We will use a drill of 2 mm diameter and 13 mm length. Select the sleeve for the narrow sleeve system for the 2 mm drill. Place it on the guide sleeve and start drilling. The next step is drill B with a diameter of 2.7 mm. Select the 2.7 mm diameter drill stopper with the preferred length. Select the drill handle from the narrow system for the 2.7 mm drill. With these drill handles, we also follow the same color code. The first drill was removed from a silver rubber, so we will use the silver side of the drill handle to begin. The second drill was removed from the yellow rubber, so we will use the other side of the same drill handle, the yellow side. And so, the sequence continues. Place the drill handle on the sleeve, position the drill, and start the process. Since it is a 3.5 mm diameter implant, we must be aware of the type of bone we are working with. If it's a type 4 bone, consider a soft bone, the drilling concludes there. If the bone is type 2 or 3, consider medium bone, the drilling sequence will continue. And if it's a type 1, a hard bone, the sequence will move on up to the D drill. In this case, in our example, we are working with a soft bone. Therefore, we finish the drilling sequence. Next, we will remove the implant directly from its blister pack. To do this, we will select the narrow system driver from the Morse taper platform in its H6.5 condition. Press the upper end of the box to open it properly. Press, open, and remove the implant from the package. It is not necessary to use the drill handle for implant placement. Just place the implant with the counter angle handpiece inside the sleeve of the guide. Complete the implant placement with the surgical torque wrench. Remove the contra angle directly from the driver and convert it into a torque wrench with its narrow connector, which can be long or short. The implant placement will be completed when the base of the wrench touches the drill stopper of the guide. Remove all the elements. With the 1.2 mm hex wrench included in the kit, capture the cover screw on the blister cap. Place the cover screw in its position. Remove the lateral securing pins. Release the guide, and the placement of the implant is concluded.